Welcome to NC Spin Perspectives, thoughts from opinion leaders in North Carolina. Talking with Dr. Conrad Flick, who is a family physician in private practice in North Carolina. We can't talk about Medicaid reform without talking about CCNC, Community Care of North Carolina. Been a lot of confusion about this organization, and if we're really honest about it, they hadn't done a very good job of telling their story to the people of North Carolina. As briefly as you can, tell us about CCNC and what it does.
Well, I mean, CCNC is an organization that started from the ground up years ago as pilot projects in North Carolina, and has grown into something that the rest of the country respects and would like to be and emulate. It is a group divided into different sections across the state, locally managed with input from the physicians and everybody else, hospitals and anybody else who has their fingers in dealing with patients on a daily basis, and trying to always look at the patient first, always try to figure out the best way to do it with the highest quality and the most efficiently.
Now, they say they've saved the taxpayers of North Carolina over $1 billion. How have they done that?
Well, I think they've done it by a couple ways, and this is better management and better identification of where the resources are going, keeping people out of the hospital, limiting hospital stays, making sure people take their medications, making sure they're doing the best they can and not overusing resources that are out there, limited resources that are out there. Duplication of services, getting an x-ray in an emergency room yesterday, coming into my office and I don't have that result. CCNC has a network that allows you to see all that information. It has care managers who work for me, not for another entity, and answer to me when I need them. So I think it's a large system, and I think they don't do enough to toot their own horn, so to speak, but it's mostly because they see themselves as the providers in these regions, as me.
On the Medicaid subject, $13 billion a year, approximately a third of which, $3 billion, comes from the state of North Carolina. There's some critics, especially in the Senate, that are saying we're providing too many services for too many people, and they want to restrict these services that we're offering, particularly with the aged, blind, medically needy, disabled, so forth like that. What do you think of the idea? Is it too rich a program? Should we be thinking about trying to bring it in a little bit?
I mean, those are some moral and ethical discussions that everybody should have about whether health care is actually a right or a privilege in this country, which we have not settled. There are lots of people who would argue on many sides about that, and I think that's, as a physician, I feel we do have an obligation. We provide those services to anyone who's broken the law and goes to jail gets free health care and gets good quality health care, yet I have working poor who can't afford health care.
Well, I mean, let's dig into this a little bit further. Okay, let's assume that we adopt the Senate's proposal and we kick, 13,000 people they're talking about off the Medicaid rolls. What's going to happen with these people? Are they still going to get health care, and if so, where?
Absolutely, and they're going to get it in the most expensive place they can, which is the emergency room after the problem has already gone too far. It's not, it's a short-sighted approach to a long-term problem, and I think that's some of this that looks for me. Are we looking at a budget cycle that plugs the hole for today or tomorrow? Or are we really looking at how we're going to care for the people in North Carolina and not kick a whole bunch of them out in the streets?
Kick Granny out on the street.
Well,
that's what we've heard. Now, so far as it goes, how would these changes directly affect you as a family care physician, or even our hospitals? How would that impact you?
Well, I think in situations like mine, it makes hard business decisions. I mean, one of the things that we do is we develop relationships with people we've taken care of for a long time. But we are a business, and like any other business, I have to pay my bills and I have to pay my staff, and I have responsibilities. And so at some point, it becomes a business decision about whether you can afford to continue to take care of people you're not getting paid to take care of. We do Medicaid now almost as an obligation to our community. It's not that we're making a lot of money off of it. In fact, we might be losing a little bit, but if they're not paying at all, we're losing a lot, and that's not, you can't give away services for free for very long.
It's not a good business model.
No, it's not.
Thank you, Dr. Conrad Flick.